Thank you. So my name is Ben, and this is Sarah over there, and we're from the Suicide Prevention Team at Relationships Australia. I want to thank you all for joining us today to take part in an important conversation about the role that a workplace plays in suicide prevention and mental health wellbeing as well. So before we start, I'd like to go over some safety considerations. You'll see in your handout there are guidelines on how we talk safely about suicide. For instance, we notice that we don't say commit suicide. So suicide is not a crime and it's not a sin. However, I don't want you to get too caught up with saying the wrong thing, because we're all learning about this, and no one's going to tell you off if you do make a mistake. It's often believed that talking about suicide will encourage suicidal behaviour. Talking about suicide not only reduces stigma, but also allows individuals to seek help, rethink their opinions and share their story. We all need to talk more about suicide to ensure that we're not afraid to talk about it as a community, while respecting and understanding the risks in certain situations. We understand if you have lived experience of suicide, it's okay to say so if you feel safe, but I would ask that we not go into the details. We'll not talk about methods, places or people who have suicide here. You'll also notice that there's a list of services you can reach out to after the session if this discussion brings up anything for you. Please know that you can leave any time if you feel uncomfortable. I just ask if you put a thumbs up if you're feeling okay and a thumbs down if you're not, just so we can go out and check and make sure you're okay. So, what is suicide prevention? So suicide prevention is focused on reducing the risk factors for suicide and enhancing protective factors. In the context of a community action plan, suicide prevention is aimed on building stronger, more resilient communities who are more willing to seek support and support each other. It's also important to recognise that suicide is complex, and there are a range of causes on both an individual and community level. Suicide can be about having access to transport to obtain much needed services or attend social activities. It's communication, ensuring people know their services and know what's available and their rights and responsibilities. It's about social inclusion, ensuring everyone has equal opportunity to be involved and participate. It's improving mental health literacy and developing skills to better recognise and support those vulnerable people. Suicide is all these things and so much more. So what is a community action plan? A community action plan is state funded and it's a community-led initiative that develops supports to promote positive mental health and help prevent suicide. CAPs are an integral part of the state government's suicide prevention strategy, with Tasmania having the second highest rates of suicide in the country. The intention of a CAP is to increase suicide prevention support to the community, dispel myths and allow individuals to look at suicide from a different angle, one from understanding and compassion for an individual who is internally struggling. Our CAPs focus on three main components. So the first component is training. This could look like a whole of workplace implementing an hour online course to increase knowledge, skills and referral options to support people in communication around suicide. This could also go as a 2-day course for a mental health first aid, so you could have a mental health first aid officer to be able to recognise someone who may be at risk at suicide and work with them to create a plan and to support immediate safety. Our second component is awareness, and that could involve coming together to celebrate days such as OK Day and World Mental Health Day, and having a guest speaker and having the subject as mental health and suicide prevention. Or you could develop resources to promote positive mental health and increase knowledge of supports. So sustainability is our last one, and that's an important one because we don't want it to feel like a one-off event. We want our actions to gain momentum and create real change. And this could look like having a mental health a regular agenda item at meetings, or it could be a mental health policy at work, creating a culture that creates a safe environment for people to talk about how they're feeling. So no community is the same and no CAP is the same. From a barbershop wanting to support their staff and clients with mental health concerns, to a statewide construction company implementing a formalised mental health policy and process. So I'll just pass it to Sarah to continue on the presentation. I'll have to take this.
Okay, so why is this a workplace issue? You're probably thinking, what has it got to do with my day-to-day work? Well, I'm sure you can all appreciate work is a major part of most of our lives. We spend up to a third of our day at work, and in doing so, we get to know our workmates very well. With 9 Australians dying every day by suicide, as a workmate or an employer, you may be the one who is in the best position to notice changes in behaviour that could suggest risk for suicide or other mental health problems. And with an integrated approach to mental health and well-being in the workplace, evidence has shown this leads to the greatest benefits. Globally, suicide is the highest cause of death in 15 to 29-year-olds. And in the Australian context, the highest rates of suicide are among males aged 40 to 49. Research by Heads Up tells us, as we've already mentioned, that 9 Australians die every day by suicide. And this is more than double the road toll. And we talk about the road toll all the time, and we create interventions and we make laws to lower the numbers of deaths. We talk to children about road safety, and there is no stigma attached to those conversations. However, when it comes to suicide, we're not quite there yet. So for each of those 9 lives that have been lost daily, it's estimated that the impacts are felt by up to 135 people. So that includes family members, work colleagues, friends, and first responders at the time of death. That totals up to 1,215 people affected daily by suicide. So these figures are closely related to people in their primary working years, which strongly suggests a need to address the issue of suicide in the workplace. And if that doesn't convince you, then we'll talk about the financial costs. So according to the World Bank Organization, globally the cost of poor mental health due to lost production is $1 trillion each year, and 10 million days of lost work annually. In Australia, it is estimated that organisations will lose around $10.9 billion a year in lost productivity due to the poor mental health of workers. However, for every dollar invested in mental health in the workplace, there is a $4 return in productivity. Workers are a business's most valuable asset, and so creating a mentally healthy, safe culture, it's not only humane, but it's good for business too. Also, you have an obligation under the Workplace Health and Safety Act to make sure that your workplace is psychologically safe. So, how do we take action? So many workplaces already have structures and resources in place to help employees get the help they need, but they often just don't associate this with suicide prevention. So suicide prevention or mental wellbeing action plan does not have to be a huge overarching strategy. It can be as simple as identifying where your strengths already lie and build upon them in a way that connects suicide prevention. The best way to prevent suicide is to use a comprehensive approach that includes 3 key components, which are creating a work environment that fosters communication, a sense of belonging and connectedness, and respect. Identify and assist employees who may be at risk of suicide, and be prepared to respond to a suicide death. Recently, I've been working with Moobrew on a community action plan, and they have given me permission to talk about this. As you can probably imagine, that work environment was typically very blokey. They didn't talk about their mental health or any personal issues. Through engaging through the CAP process, they have reported a huge change in their workplace culture, and then they're in the very early days at the moment. But connectedness is now a major focus with their team, and team members take it in turns each month to host a team afternoon where they talk about the things that are important to them and just concentrate on those bonds. They've also reported that mental health is no longer a taboo subject, with workers openly talking about their needs. And as I said, they're still at the beginning of their journey, so it's going to be really exciting to see where they are in 12 months' time. So, creating a CAP in your workplace is easy. And if this is a journey that you decide to take, you'll have the assistance of a Relationships Australia project officer throughout. The first step we take is we come to your workplace and we meet with the relevant people. So that could be management, a wellbeing committee, or health and safety reps. We'll discuss where the business is at currently with mental wellbeing and what you already have in place that we can build upon. We'll also discuss some timelines and a consultation plan. Then secondly, we will run a consultation with your staff or committee, and this is adaptable to suit your workplace. So it could be surveys online or on paper, we could do a workshop or an interactive forum. Then we will analyse the data gathered and identify where the gaps are. So from this, we will then make suggestions of actions that you might wish to take. And we'll meet with you to discuss further and help develop your actions. And then finally, the plan goes to Relationships Australia leadership for endorsement, and then it's up to you to implement your plan. And you can also apply for a small grant of up to $1,500 to help implement your plan. And I should also clarify that our services are completely free. So, I'm now going to invite you all to think about your workplaces and how you can make a start in suicide prevention. There is a worksheet in your little packs. So I'm going to give you about 5 minutes to have a go at filling that out and discuss it on your table. So just have a think about what is your workplace doing well and where could you be doing more. So if you have an Are You OK Day event, is it all about the cake, or do you actually start to share information about mental health and suicide prevention? Do you have a workplace mental health policy, but do your employees actually know that it exists? Because you would be surprised, many don't. And do you have a workplace employee assistance program? But then again, do you advertise that to employees? Do they know it exists? And do you know how to access training to be able to assist a person in distress? So I'll give you 5 minutes. Have some conversations at your table, and then one person from each table can report back and tell us maybe something that they found about their workplace that they would like to go away and work on. Okay, so like we said, we've only had half an hour and there's a lot to go through and we can't get through it all today, but I hope you can take away that this doesn't have to be a huge overarching strategy. Small actions can make a big difference, but everyone can do something to prevent suicide. And we are here to assist, and our contact details are on the flyers. But I'll just quickly pass over to Ben to wrap up. Quick mic change.
There we go. Cool. So before we wrap up, there's one thing you can do today to start taking action around suicide prevention. So I'd like to invite you all to take your phones out. And go to your camera. There is a QR code on each of your worksheets. And if you scan that, that would take you to our TSPCN page to to sign up. And so the TSPCN is the Tasmanian Suicide Prevention Network, and it's a statewide group who meet on a 6-week basis around the state. And it's for everyone that has an interest in helping to prevent suicide in Tasmania. The focus of the network is to share information and work together to reduce the rate and impact of suicide in Tasmania. So by joining the TSPCN, you can find out about initiatives, training and funding opportunities and forums happening around the state. We're on Facebook as well, and we'll send out a monthly newsletter to keep you up to date and you know, when the next meeting and where it is as well. So you're more than welcome to join up. I think we've got our next meeting in Hobart on the 27th, is it?
There's a Launceston.
Oh, is it really? Oh, okay.
And then the second.
There you go.
In Hobart of December.
Glad you're here. So yeah, thank you so much for listening today. I think we've got a bit of time for questions as well, but we'll be hanging around as well if you do want to ask us anything. Yeah, personally. Fantastic. Thank you very much.